And so we're urging you to exercise restraint. We apologize for the few minutes delay, but very soon we'll kickstart the program. Thank you so much. Ahinana Troop, you may continue.
Hello. Other was on fire Makwaba at about Dan Kwakuyabwa TV on YouTube, Dan Kwakuyabwa on Facebook. You know, can say PMO, I walk Koforidua and the official launch of John Kumah Medical Center. I had a Sabri PMO higher than also say Eddie Bremo. It's an ultramodern health facility. Yes, see, Koforidua. Intended, Baba Commission. I say now your original, your MC, ain't done Kwakuyabwa. Every PMO, Koforidua. It's I for no anybody for best starting on Martinasina, Eddie Medino, Artificial, I say. Sabra can say. I want to say I can't remember. You can be say I want to say Kitty and now a home Abufuma Sabri or Maba or more Sabri or Maba more or more Sawa has say. So these are the dignitaries or Maba or more grace location here. So very soon I'll take you guys through the tour. Our the facilities that I be Hunia is here the air course so our has say. This is the high table. Kasi Brunino. I said, yeah, I'll do a hand. I don't want to stop the other say. On Toronto. Also, they are selling it. And they are selling it to I say. So, the home for Bernard, the neighbor, I say. Sabri Danko Kuyabwana Abaya MC for the event. ɛne saa bere mmerɛ wɔka sɛ ketefoɔ ɛna ɛbɔdi agorɔ ɛwɔ ha se. Go live. Yo, Jata. What's your name? Oh, okay, Martin. May your life is a cat. All right, so your life. It's me now. Can say, I have a minute. Can I talk to someone here? Can I be the microphone for me? What are we doing right now? So should I hold it? Oh, yeah. So your life. Yeah. So what are you doing here right now? This morning I can see.
So here is the lab.
Working here. What are they doing now?
So here is the lab department. They are running the labs. We are running for Hep B, Hep C, HIV, blood grouping. I think that is what we are doing here. But aside the labs we are doing here, this one are for free. They are for free. This one is for the screening.
We'll kickstart the program.
Okay.
And I'm sure you are happy being here.
Categories that you are taking care of.
Mainly for the screening, purposely for today, we are doing only hepatitis B and hepatitis C. We are doing HIV. We are doing blood group, and we are also doing typhoid, because typhoid is one of the prevailing diseases in Koforidua. So we are working on controlling and curbing it.
Of Kumah Medical Center.
All right. So thank you very much.
The biggest fertility center. The biggest hospital.
The biggest fertility center.
High table. Medical Center is the biggest private hospital. The biggest private hospital in the whole of the Eastern region. That's why I said it is the biggest in the region.
Yo, ago benkum nifa kurti apasamaka chidom apeja akwamuni adonten teri chidya aronya ode na de na eche oje aho tete pempong repong chidya aro asasiura beba be company insa inti besre ya nidi wono ne da wono Kebesre na obia manumuso na assembly asasiura now yesre obia manumuso asona ni jumuna ire preapa ododo ebusia muni amanfo ododo ya kwanzu na ya sasa unaweze ne ampa mea vira kuna nai ayine vira bro o sujana na obiva be kumno diva akuko fufia akromasa oso oje pretete jebi adanse akonchire damanama onema kuma ba de o ka chire oje bobi bazo edu apodo mg
registration number ER 6814. You are requested to attend to your car. Thank you. Good morning, now, distinguished ladies and gentlemen, and welcome to the official commissioning of undisputedly the biggest private hospital in the Eastern region, Kumah Medical Center. Thanks so much for being here this morning. Your presence is deeply appreciated. It is customary as Ghanaians to commence our programs with prayer. And so without much ado, I'll call on Reverend BTS Amate to give us the opening prayer so we officially commence the program. Let's put our hands together for Reverend, please.
Can you please be upstanding as we give God honor? We are praying to the Almighty God, the owner of the earth and all the rain. I'll pray. To God be the glory, great things He has done. It is by your mercies that we see what we see today. Thank you for your son Kumah and the family. And thank you for imparting humanity, even through them. We bless you for their lives. As we gather here today, O Lord, show us mercy. Take over this gathering and let your name be glorified. Let this facility be that which will bring glory to you. Your son Jesus came on earth. We saw him healing people. This is what your man servant and his family desires to do. May you grant that this be fulfilled to your glory and to your praise in the name of Jesus. Be Lord, O God, be Lord, and have your own way in the midst of this gathering. Thank you for your presence. In Jesus' name, amen.
Thank you so much. Oh, let's do it better for Reverend. Oh, when I put on my money, find someone from the Americans and what that. But someone said, man, that they don't have it. Thank you, not sure. Yada Onyankopon Ase. Before we continue the program, there are a lot of distinguished personalities in our midst, and protocol demands that we introduce them. The gentleman who gave us the opening prayer, Reverend BTS Amate, thank you so much for being here. Your presence is highly appreciated. We have in our midst Mr. Yao Edu Asamoah, Chief Director, Regional Coordinating Council, Eastern Region. Let's put our hands together for him. He's representing the Regional Minister. Mr. Felix Ado Ochri, Regional Director, EPA. Ochre. Let's put our hands together for Mr. Ochre, Regional Director, EPA. Rahel Ajua Amofa is the Deputy Director, Administration, ERCC. She's also in our midst. Let's put our hands together for her, please. Elder Michael Yabua Boji, representing Apostle Anthony Mensah, PIWC, Atomic, Accra. Thank you so much for being here, sir. Sedia, Yimya Kumah, di Kambu Bosso, and Nano, Ewayentem, Kura. Wajia Obo, Nana, Titipimpo, Tosum, you know, I just saw in Nana Okaso, Yamakwaba, and Sam Emma, Nana, Nanama, you know, Manka, Mambre, Aira, who have said, Nananum, Afom, who Abeta Chia, and Penning Force, who was a Crotia Mansa, every Crotia Ba, Adam Namatua Nanua, Yamisano Quinso, Natchez and Nanama Crado, some of the Munimidie, any Omo Elumonyam. Ebeta Kumah Medical Hospital echi oyamo yasema omubio omaya de papa awo Koforidua awoye agesohima acting ono nso ewe yentem yemo yensema yemame oba hema hofe nsemo ni so a nyame shao Nana Edu Asare Mankrado ageso ono nso ewe yentem nana yemo akwaba Oketeche Apreku Jampo Jasehene Ajeso Nana Onkwaso Yemu Akwaba Ochiame Adade Ewe Yentem Anachiame Yadase Emu Akwaba Achiame di Omu Nya Papa Nana di Nenumu Nsem Betudwa na Yabeti ni ya Nefri Achiame Adebia Yeko Menshiana Otumfo Eshia Kotokofo na Oshasi Eso Kasamenananom na Chiame Sisio Kotokotimi Boli Mimbobi Ochiame si nanasi wanto ne naenda otumfo so obua mankasa enti achiame fo no o manka ne ya yenti ase ye yembo yensema na chiame adade bio ochiame peni ofi ono nso ewo ha yembo yensema ema no o bonsema mo nanano ma yehia manka mambre aira eda masibebre nyame enhira mo esan ema mo akwaba. We have in our midst Health Services Director Dr. Wilfred Ofosu. Let's put our hands together for Dr. Wilfred Ofosu. Thank you so much for coming, sir. Private Health Association President, Dr. Wabi Frimpong, has also joined us this morning. Let's put our hands together for him. Because this is a special project, Ghana is doing this in collaboration with the most powerful country in the world. Take it or leave it. The United States of America. You get $1 for your brother. And so there's a medical team from the USA. Dr. William Chester is here. Let's put our hands together for him. He danced the beautiful Abuela this morning. He's a very good dancer of Abuela. Oh, let's do it better for him, please. Dr. William Chester, all the way from the United States of America. We have Hefra Regional Director, Mr. John Asumini Ejapon. Let's put our hands together for him, please. And of course, Hefra Chief Executive Officer, Dr. Philip Bambo. Distinguished ladies and gentlemen, thank you for joining us this morning. We believe that this is in pursuance of development from the health perspective, and to a large extent, it is going to help the indigenes of Koforidua. Of course, unfortunately, Oshes no friendship with the name, and the other program goes on. I will introduce him as well. Let's put our hands together for them, please. Zongo Hini and the entourage. Oh my God, the papa, Monsugo, Manunya Batayachi, Oshes no Mr. Monjo Mudino, Emaye, na Yemfa Omudi and Tuya. We appreciate your presence so much. Na Jumedino, Enyadia, Yayan Tintin, and Tijuan Yomaso. The most important thing is that we're going to commission the biggest private hospital in the whole of Eastern region, the biggest fertility center in the whole of Eastern region. Oh, and you know that it is not every Ghanaian living abroad that will have this vision of coming back to impact in the lives of his people. Abrochire tena enough more. Yana eti Kumah yagi nse sika gugu from abrochire. Akwabi ekotena. Okay, I'm even told to say on tena abrochire da. E Ghana from yagi ni nyo mu dia fe bi visa fi abrochire. Dia mu fanchem. Because me hu say America for abem no. Na me fi say ja si wo no mu na ho. En we dia watemeto. Enti so we decide say nyame ato ne nsem na obeye bibi e de aboa ne manya adesona nipa no ese e bona baso yemo yensem ema kofa bai na mame manu ni background kakra Dr. Raphael Kumah Ametepe, oye consultant, SIA orthopedic surgeon, Hope Exchange Medical Center. Sorry, Hope Exchange Medical Center. Ewu Kumasi. Yemo Yensem Emano. A consultant and orthopedic surgeon. Hope Exchange Medical Center. Ewu Kumasi. Also, the president, Orthopedic Association of Ghana. Also, the former head of department, Accident and Emergency Department, Ewo Konfanoche Teaching Hospital. Wasai head of department, Department of Orthopedics, Ewo Konfanoche Teaching Hospital. Or a specialist when it comes to joint surgeries. Distinguished ladies and gentlemen, let's put our hands together. A very loud one for Dr. Kumah Abatabe. Now, Bernard who did you want to say? We didn't tell which year. Eddie. Oh, let's put our hands together for our mothers. Now, who did you want to say? We didn't tell which year. Hey, because what choke what you chamber on no pressure. Hey, I don't know we have mentality where die. Woman who are coping. Enti doctor, it's like ye. Okra, yama mia, onoso ye anesthetic theologist, specialist, Dr. Irina Kumah Ametepe, onoso ewe yentem. Oh, Kumah Musama no, let's put our hands together for her, please. Auntie, if you are Dr. Von One, we hear we are near Bob Money. You mistake of companies out here, but you are being. Eti yema mene ya papa ena omoye kofa bai enei yeso ba kufo de kumsono na amansan ina etwetwa bi awi eti mensebre no medikan age ya papa na no disem owia na fe ya papa mu a omo frizo go bai ni penifo wo ha omo ti omodin no na ye do omodin atudwa. Distinguished ladies and gentlemen, Yamfa and Simo, Annie Delio, Amfacha or Ernest. Now, yes, I was with Yan Homaso. Now, if you are not introduction, if you are to us, as an adopter, you may say,
and now 7:30 and over peace FM. No be at all because Nampa Kuba was rather than himself. You see, what changed him a war of a Kumah family and a year of a the leader at Buswano, Musa, won't name. Na on fight my dear Milan so I see also Mr. Nicholas Kumah. Inti ya befreno na wani aba beche edumadie ni nyina no botara etiechi bibi fiba abusuani nyina kabo mu a odi anu no omatimi aye ni nyina yenumu no na abemu sele Dr. Raphael and you Busafo aka omuna ye akukunam ina do mahodi esuwa ti reference about esepa Asia yen bra yen papa Mr. Nicholas Kumah.
Thank you very much, Ernest. But Omufi US or Mutirantino, I am the Befra, Banetai, Akabo Fakata. Dan Gobiawa, Yadasi. Na ansa na mehyaseɛ no mepɛ sɛ Mrs. Florence Kumah sorry no adwane me wɔ ha. Dr. Mrs. Irene Kumah mpatsɔ mepɛ sɛ wo nso wobɛ bi. Dr. Raphael Kumah mepɛ sɛ wo nso wodwane me. Alfred Kumah, where the Mestre Maka, Kumah family no, eso. Same kase ni bubodia, ye inti yedesi Alfred Kumah so. Nananum penifua, mweshia mwa. Distinguished guests, our brothers from the US, ladies and gentlemen, I am honored to stand before you today. We here represent the management members of Kumah family. The hospital is owned by Kumah family and the community of Adeso. I am the team leader, so I have a story and we have a story to share with you. Before the onset of COVID, the family used to spend our Christmas with the Ghana Prison Service, the inmates of Ghana Prison Service in Koforidua. Almost every year, we cook for them, we go there, we serve them, we celebrate Christmas with them. We have been doing this for the past 5 years, but with the onset of COVID, it was difficult mingling with them. So an idea started. We decided to do something for the Central Hospital. But before I proceed with my story, I want to use this opportunity to thank the chief and people of Adeso, and more especially our neighbor, Mr. and Mrs. Sumwa. We have been disturbing them every now and then, but they have been very patient with us. Thank you very much. I also want to use this opportunity to thank the architects and the biomedical engineers who designed this edifice. And more especially Mr. Eric Jan, the contractor who put the design into the physicals we see today. Thank you very much. I also want to use this opportunity to thank Dr. Amponsan, who works with the Central Hospital or the government hospital. Dr. Amponsan has been very supportive. Thank you, Dr. Amponsan. So I'll continue with my story. So COVID started, and then we decided that we have to look elsewhere. So I spoke with a friend, and he recommended that the Central Hospital needs a genset. So we decided to buy a genset for the hospital. I went there one day, and I was told to wait. I guess the administrator was in a meeting. In fact, I did not inform him before going. So I waited for almost an hour, and out of anger, I left. And that is the genesis of the structure you see today. came home, I discussed with Mrs. Koforidua, and she gave me her blessings. The next day I went to the office. And discussed with the colleague, Mr. Enes, and he made it very simple. Oh, Mr. Kumah, it is easy. My uncle has a hospital, you can do it. I'm like, wow, is it that simple? Ernest. So thereafter, I discussed with Alfred and my big brother, Dr. Raphael Kumah. He sat me down and said, Guy, you know what? I have also acquired a land in Kumasi. I wanted to build a hospital in Kumasi. So if you have come up with this idea, let's see how best we can all support to make it a reality. Thank you, Dr. Ari. You allow Dr. Kumah to visit Koforidua almost once every 2 weeks. He comes here to support and advise. Big bro, thank you. I will want to also express my gratitude to Dr. Claribel. Some years ago, Dr. Claribel has been our friend. So some years ago, I was having a chat with her, and I told her one day I will build a hospital for you to manage. Little did I know that I was prophesying in my own life. Dr. Claribel, please be on your feet. Thank you very much. And when I spoke with Dr. Claribel, she told me she was busy, she cannot join us. However, 1 year down the line, she called to say that she's convinced she wants to come on board. And the truth is, when she came, it was just blocks. There was nothing to show. And for the past 2 years, Dr. Claribel has been with us since. Dr. Claribel, thank you very much. I have one more thing to say about Dr. Claribel. Last year Christmas, she was here. And Ghanaians as we are, we had all gone for Christmas. And she broke down in tears. Why should we go for Christmas when there's work to be done? I told her, Dr. Claribel, I'm sorry, this is Ghana. And through the collective effort of all of us and everybody sitting here and the Kumah family, we have been able to put together this edifice, which is a 50-bed capacity hospital. This hospital boasts of an X-ray, a CT scan, an IVF center, an MRI is yet to be set up, a dialysis is yet to be set up. We hope that in the next few months that will be done. We also have a dental unit, and I'm happy to let you know that our brothers from the US, Dr. Chester and team, have donated a dental suit for the dental unit. Dr. Chester, thank you. I will want to end here for my big brother to continue. So thank you very much for coming and thank you very much for your support. We are just about starting. My brother will do the concluding part.
Thank you, Nick.
Stand by here. Stand by here.
Nananum, invited guests, some of whom are my classmates. Yes, I can see them here. Sariki, we have Zongo background, so we can speak Hausa very well. Sariki Sebezua. Ladies and gentlemen, for the sake of our brothers from the US, I think you speak English, but from time to time we add a local language for everybody to be part of the ceremony. Yes, as my brother said, it's been a journey through the COVID period, and when actually my brother Nicholas told me of his intention and the project, I said, oh wow, I've also acquired the land which we wanted to start in Kumasi, also a center which eventually will have come out, and we still might come out with it as a Kumah Medical Center. So, when he told me of it, I said, okay, Koforidua is where we come from. Koforidua for it, you make free as here for Koforidua, but if you are free and standing so let's start from Koforidua. It's a good idea, so that when we get established, we'll extend and expand our wings. So we decided to do this project here in Adweso. And thank you again for the people of Adweso, for the neighbors, for enduring our noise, our coming here with cars, with trucks. It's not been easy for you, we know, but we needed to have this done. And we thank you all for making us fulfill that dream and make today a glorious day to all of us. So, it was a significant milestone. The Kumah family, I'm the first doctor to have come out of the family. I remember my days in Pope John when we were day students and to St. Peter's. And so I was encouraged to become a doctor. So I became a doctor with all of them, their help. And I had opportunities to stay elsewhere to make my money. But I said, no, our background is, we are from a very humble background. So it's better I come back to help us and the entire family who are also in that humble state. So you can see my wife is not from Ghana, but I convinced her that let us come home because I belong home. So I came home. So I've been in Ghana, and it's not been easy working here in Ghana. Media resources, my mates know, and we tried making it slowly. Then I had a scholarship again, went for specialization, and came back. So I was called actually back. I was forced back. Then the Konfanochi Asset and Emergency Department had been completed, and they needed me, an orthopedic surgeon, to come in, open it up, and operate the place. So we decided to come back, and I came back. It's been a difficult journey, but we've been able to manage it, and we've made it to the stage we got to. Before I said, okay, then let me have my peace and collaborate with the family to do what the family wanted me to do. But thanks be to God, a lot of us have joined the trail in the medical field. I have my 2 children who are doctors. My brother's child is also training for medicine. My sister's son is also a doctor. So we are trying, and we have a lot of our brothers and sisters who are nurses, who are doctors, who are willing to come back to help the society. Because we always tell them, our children, we are from a humble background. So, this milestone is something we decided to follow to provide quality health care to the people of Adeso, Koforidua, and to the entire Eastern region, and possibly, who knows, to the whole country. So, thanks be to God and thanks be to my brother, we've been able to complete this edifice. It's going to be the top notch. That doesn't mean we're going to take care of only the house. With the collaboration of our Americans, we will be organizing programs so that we can take care of not only the house, but the have-nots who have serious medical problems and need serious, very expensive surgical or other medical procedures. I also have to thank Dr. Claribel. In fact, I didn't know her. My brother had been talking about her. I had never met her until I met her the first time, and I was amazed about her enthusiasm, her dedication, and the way he foresees this place to be. And actually, she's followed that through and through. And the ability of us being here today, the possibility of us being here today, is a lot of it is from her dedication and work. So Dr. Claudia, thank you very much. So the journey has not been easy. We have had its ups and downs, but I think today marks a very, very important day in the life of all of us, the Kumah family, and the dream that we have. So all of you who have been part of it, either actively or passively or through prayers, we thank all of you, and we hope you continue to help us, and of course with the support of our spouses, to help us to make things develop so that the dream that the Kumah family has will be fulfilled on this earth. And when it is fulfilled, it will be fulfilled for all of us, for the people of Adeso, for the people of Koforidua and Eastern region as a whole. Thank you.
Mr. Dambo, yes, I'll be given and granted the permission because of the contributions of Dr. Claribel. Dr. Claribel, the last four, which comprises of 4 operating theaters and an IVF center, has been named after Dr. Claribel. I know some of you may be wondering as to what I do. I am a farmer and a businessman. I have a friend. He's more than a friend. He's a colleague. He's a business partner. And because of the partnership I have with him, we established the biggest plantain seedling nursery in the whole of West Africa. That man is called Mr. Joe Forson. because of this partnership and the fact that our partnership has worked well, the second floor has been named after Mr. Joe Forson. Mr. Joe Forson, I can hear please. So the second floor is called Joe Forson's floor. Thank you very much. Done.
Another round here for the Chief Executive Officer, Mr. Kumah. I show appreciation. Madam Dr. Clarabel, I see, Oba and I would be bringing an also. Ghana, you would be bringing an also, and you always want it. Then I be holidays in the year, and I didn't want to get them. Yeah, the Yoruba hospital and his ability. That's not answer for her. She's very hard working. She's very hard working. In fact, there is one Mr. Nicholas Kumah, what she said, or a unifier. Kumah family, no. And now, Moya Koforidua. And what you was in the BH, Nina Penny Raphael, so actually, almost within a whole day, in India, at H.A. Cassay, the digital Kusina. Once again, your boy, Kumah family, they done so well. So, maybe economic, there are a lot of distinguished personalities in our midst that we are here to introduce. Yewo ampeku nana onyema jemfua ewe yentem yewo yensema nana onyema jemfua ampeku abeka yensa wa ha ene. I've been informed. Say, Yamamia, oh, your papa, and they, but they are the Sabia, my baby home, Yamamia, and Timama Pena, Bakabi, as your mammy and Munam, Nitty, and I did Kumah Busana, ever lose her purpose. The boy said, you are Mr. Nicholas Kumah.
Na esesenka yebetena enuwe ka yama minuso ebetena yete se mutu mwani ehwa yama minu etiwo obi no otiwo omo ya krafo enso omo ti se eniafo sana abujano etie nanka yebepese omo be kaya omo ha nanso yɛnyina yɛnti ɛmɛgyina so a yɛda wɔn ase ɛyɛ wɔn nkabom ɛna ɛde yɛduru baabi a yɛduru ɛnɛ yi yɛda wɔn ase.
Mpacha nsɛm no nsa ɛyɛ obiara na ɔyɛ sika na ɔde bi ne man wo sɛ wona sika na de bɔtɔ ma na wo yɛ ntɛ gidi a obiara mo. So it takes a visionary person to put up such an edifice. Let me better for him, please. We have in our midst DCOP Imamo Chumesi Ankara, Regional Police Commander. Thank you so much, sir, for joining us today. Your new job in North, Super Chief, Saki Omar Farouk, welcome, sir. Join Daddy Multimedia, General Manager, Mr. Isaac Akuti, Of course, we have reps from the Forest Hotel. Also, if you don't know, I got home. You won't have come back to see if say that we are in Tien so Koforidua. We are Kumah, Ebusna, everyone who is at today. Health Services Director, Dr. Wilfred Ofosu, and also Ednanumun Sem Abre. Let's welcome Health Services Director, Dr. Wilfred Ofosu.
Thank you, MC. No. It's Nicholas Kumah and the Kumah family. My colleagues on the high table, starting with the chief director, Mr. Aidu Asamba, representing the Honorable Lieutenant Minister of Eastern Region. My colleagues, Mr. Felix Autry, EPA Regional Director, Dr. Boadun Frenpon, the President of Private Health Facilities Association. Our colleagues from the United States, Dr. William Chester, the leader, but here over and take the people on the second at the ceremony. My colleague, Regional Health Director, Mr. Japon, and the CEO of HEFRA, Dr. Philip Bano. When I saw our phone, you'll be able to make it, and we are grateful that you made it. Colleagues on the high table, my colleagues from Regional Health Directorate, ladies and gentlemen, all the protocols duly observed. First, I want to say that we are very appreciative of the invitation by the Kumah family to participate in the commissioning of the Kumah Medical Center located in Abiso, in the New Durban municipality. We welcome the Kumah Medical Center as one of the newest privately owned health facilities in the region, and this goes a long way to fulfill the government and the Ministry of Health agenda of making health accessible to all the citizens. The Ministry and Ghana Service currently our main thrust up to 2030 is to ensure that we achieve universal health coverage, which basically means that everyone, no matter where you live, you have access to services that you need. And I believe that one of the services that we have not had in this region is in vitro fertilization service to help couples who are unable to achieve pregnancy normally. And so this becomes accessible to our people in the region. In addition, in addition, we are looking at increasing quality of care. And the private care facilities have a great role to play when it comes to achieving the universal health coverage. And that's why we are happy to have the Kumah Medical Center on board. Looking at the edifice on the outside, it's a very beautiful edifice, and I believe that everyone who comes to services even before receiving the service, will be here. But the most important are the people who will work in this facility. And we are hopeful that they will provide excellent service to satisfy all the patients and the clients that come to this important facility. We have very good collaboration with all the private facilities in the region. But one of the challenges we've had with some of them is their inability to report statistics, records of health service delivery. And so we will urge the Kumah Medical Center that they ensure that they are able to report appropriately to the new German Municipal Health Directorate. Through the institute, the president is here and he knows, so that we can have complete records of the health statistics in the region. We also wish to assure you that from time to time, as the representative of the Honorable Regional Minister for Health, we will come around to see how the services are ongoing and to make sure that they conform with the expectations of the service. On this note, we wish to assure you of our support as the region in charge of health, whatever we can do to make sure that this health facility lives up to this expectation. If you do encounter any challenges, our doors are always open 24/7. You call us and we see how we can support you. I take the opportunity once again to congratulate the Kumah family for creating this important edifice, which adds onto the normal facility that we have and extend it. Thank you very much.
Thank you so much. We pleading with the speech leaders to speed up a bit for us because the weather is very scorching. Thank you so much. Let's put our hands together for Dr. Winfred Ofosu. We also have in our midst Dr. Justice Sai, Faculty of Law, University of Ghana in Kumah. Thank you so much for being here. Your presence is highly appreciated. Next on my list is the EPA Director, Mr. Felix Abdul Oche.
Thank you, Mr. Koforidua. For want of time, let me stand on the existing protocols and just make a statement. Today, I am extremely excited. Extremely excited. And the reason being that while I was in Kumah yesterday, I got to Koforidua this morning. Initially, I didn't want to. Not I didn't, but I thought that I may not be able to attend this meeting. And but with persistency from my brother from Hefra, the Hefra Regional Director, I said, well, let me try. So I got here this morning and straight to the program. And I told myself that Semama Anka Maya Mahopa, number one. Number two, Mamba Akamadibe Papa. The reason being that Raphael Kumah is my mate. That's a classmate. I am not to Koforidua convocation classes. I go to a class where you say, not from, now you decide not to come. I take a little papa. But when they started, it was, wow, we will come around here, structure this year. and the nature of the land. We are thinking, what is it? Is it a hostel? Because the university is just here. And then we also say, what at all is it? It's an apartment. And the EPA, because we grant permits to send facilities, what they are doing here, so that we can ask them for permits. Until one day they came to the office with a name for the registration. So we didn't even know where it was. Then we came. Then later they brought a letter that they are changing the name to Kumah Medical Center. Little did I think that my brother is part of the team. But we came here, I personally visited here because I wanted to see what was going on. Especially there is a stream, small stream, behind here. So we said, well, let's go. If it's a medical center, how are they going to treat their waste? So that the waste will not affect the water. Because we have to say that so that's why it's a small stream. It will definitely be a tributary to one bigger one that we use. So I was personally involved in the assessment. And I'm happy that I personally got myself involved in my brother's property or brother's project. I think I am happy today. Interestingly, I have two of my mates who have hospitals in Koforidua. New Lands Medical Center is our mate. Atetem Medical Center is also our mate. So now when I get the third one, then it means that, we will have a beer for. So that is what I'm saying. I am highly excited. And with the nature of the activities, the services that are going to be rendered here, I'm so happy. And the last time I came, I said around here, and even in the Eastern region, I may be wrong anyway, I haven't seen in the medical center running the IVF. And so this is going to be the first one that we have. And it's in Koforidua. It has always been broken down. But today, it will be Kumah. And I think it's a good news for Eastern region and Koforidua as a whole. We will continue to support them in all their ways. Let me say emphatically that they have environmental permits, which is very, very valid. And we will encourage them that at any given time, they would come in with a renewal. And Ralph, I would always be there to support. Even in my absence, I'll get people to support. What I would also encourage, when I was looking around as an environmental officer, looking at the greening nature, initially I said, green issues are here. And so I hope that they will add more to the green nature of the place. Because the nature, the green nature, in itself is a healing material. So if you come into an environment where you have greens, you yourself, like my colleague Senior said, you get healed before you even enter the place. I want to encourage management to continue to work hard. The things that we were told when we came for the assessment, the things that we saw, we are hoping that we will be able to maintain it and then keep it for a very long time. I would also add my voice to the staff. Please, it is our property. Whilst you are working here, take it as your property. Because there's this saying that, so we will be here, and I also would say, hey, it will happen, and Father said, commit yourself to whatever you are asked to do. And let us continue to maintain this place. And I ask management that we should try. Now, Ghanaian adage said, Ghana there, culture of maintenance in Ghana. The best said, we continue to maintain. because it is so NIPA, so that the hospital will be there for us and will be there for us for generations yet unborn. On this note, I want to again reiterate, we support the medical center in all our capacity to let it work for us. I stay around, so it means that I'll be visiting frequently. No, not frequently, many times. So I'll be visiting when the need be, and occasionally we'll be monitoring to see what it is. Whenever you need any help, our doors, our doors are open. Come around. If you have a maternity, our concern is that of the disposal of the placenta. So we'll look at that, and since my brother will be standing by me, let me end here. Thank you.
Mr. Oche, Ado Oche, Mr. Ado Oche. What I have here is Oche, so it makes it difficult for me getting the right pronunciation. Please forgive me. I said, I'm a client. I get to Libya and offer friend or Casatin Tintinos offer. Don't scam on school. I put to be in the way change the Cobogla. I'm scam crashing my daddy church. And the Ocasano says a monarch was run as a poem. Private Health Association President Dr. Babin Frimpong will also give us a remark.
Thank you very much. Good afternoon to everybody here. I wish to plead with all of you to permit me to start an existing protocol to deliver my message on behalf of the Private Health Facilities Association of Ghana. I would like to introduce myself. I am from Gabon at the sea, because I know my Gabon kings are here. And I'm also, I was born in Zongo, I was born in Lima, and I grew up in Lima, so I'm more or less a Lima boy. Thank you very much. I'm very delighted to be part of this ceremony. And by all standards, we can't dispute the fact that this facility, this edifice is a great one. And I'm very sure that the HEFRA registrar is very happy with this edifice, because by all standards it meets its requirements, especially the upcoming renewed requirements of the Private Health Facility. It is a dream of the Private Health Facility Association of Ghana to have all its facilities upgraded to meet modern standards of the HEFRA. And while doing so, we will make sure that we will encourage each and every investor into private health service provision to do things according to modern standards that ensures quality of healthcare to our sake. While doing that, we should be mindful of the healthcare access need of our people. Access to health is a fundamental need that every country needs to strive to achieve. In trying to achieve that, we have to strategize in the way we benchmark our standards with standards elsewhere in order to attain some level of quality without compromising the need for ready access to care. We need to be encouraged to resist, because besides enhancing access to healthcare, and when I say we, I mean we Ghanaians that have decided to invest into private health care, we need to be encouraged to resist. This is important because besides enhancing access to care, our employment challenge as a country is met partially by our existence. As beautiful as this facility is, very soon it will have to start grappling with the high staff turnover challenge that all private health facilities face. We most often than not have to make do with the freshly trained graduates to manage our facilities for us, simply because we find it difficult to keep up with the demands of those with the requisite experience that we may want to keep in our facilities. Many a time they are ready to receive postings from government and leave our private health facilities for us to think about engaging newly trained people. As an association of private health facilities, we are in touch with government, trying to support us to maintain our staff, so we don't get to see high turnover of staff. As the regional director, I will encourage Kumah Medical Center to take reportage of data, facility health service data, very important. Well, I used to be the data manager for the country, and I have that background actually as my expertise, so I'm very interested in data. But more importantly, is by reporting our data as private health facilities, that will let government appreciate what we are doing in terms of what we contributing towards healthcare in Ghana. To end it all, I'll tell the family, the Kumah family, that the Private Health Facilities Association of Ghana is in total support with what you have set out to do. We are there to go through pain and paid review to help achieve the vision for this very setup. Thank you very much. Thanks.
Oh, last time I get in thinking, then you say one by thinking. I've been informed the owner of Baka Hotel, Mr. Boating, has joined us. Let's give it up for him, please. Mr. Bright Boating, Interfarmer and Empire Court Hotel Chief Executive Officer, is also here. Thank you so much for joining us. Your presence is appreciated. In the course of my introduction, I did say we have a team from the United States of America, led by Dr. William Chester. It is his turn to give us a remark.
Thank you very much. I won't be giving a speech. I'm going to tell you a story. And I'd like to start this story by thanking everybody who's allowed me to make this story present to you. And I'll come back to this, but this story, the understanding of why I'm here, begins with my 6-year-old grandson. Now, I know many of you say, you're way too young to have grandchildren, but it's okay, I do have a grandchild. I went to his class, and that class taught me why I'm here. My name is Bill. I'm an anesthesiologist, and I figured, what can I do in Paul's memory? Let's help other children throughout the world that don't have access to care, or maybe they do, but they just can't pull it together. So, as a result of that, the Paul Chester Hope Foundation was founded, and here we are. And we've been working now in 2025, it will be 20 years of us doing this type of work. So, hopefully we will be here in 2025, and that's why we're here now. So, how did this start? My anesthesia technician, Kumah, came up to me many years ago and said, Dr. Chester, let me introduce you to my brother. His name is Ralph. He's an orthopedic surgeon. I said, oh, great, I'm an anesthesiologist. I can relate. So he said, oh, he speaks Russian. I said, oh, my wife is Russian. So I greeted him in Russian. He responded in Russian. I said, oh, that's cool. And then he said, and his wife is an anesthesiologist. I said, oh, Alfred, this is bringing a lot to the table. Very nice, very nice. So I met Ida for the first time on this trip. And that came together. Maybe a year or two passed, and Alfred said, let me do is Nicholas. And look what he's doing. He's building a hospital. So he thought, wow, that's pretty cool. Building a hospital. I'm still not putting it all together, but that's very cool. And I watched the hospital grow. And I watched Alfred tour the hospital. And when he brought back the pictures, I said, maybe I don't want to do volunteer work. Maybe I want to come here and work myself, because this is better than my work. So then he started getting more and more interested. Like, why don't you come visit Ghana? Why don't you come talk to my brother? Okay, let's go ahead and set this up. So we did, and here we are. And what we intend to do is come here and collaborate and contribute our expertise and learn from you and maybe bring some high-tech stuff. It's a little hard to get here. And maybe this will turn into the longest running mission site we've ever had. So that's my intent. It will be a lot of work. And when I say a lot of work, tomorrow morning at 4 a.m. I leave for Casablanca where we're running a mission in Morocco. So this is a long commitment. This is our fourth trip to Morocco. And we hope this will be added or replaced with, we don't know yet. But I do want to bring back why my 6-year-old grandson made me understand this. So I said, Leo, what is this story about Africa that you're reading in your first grade class? And he explained it to me. And he told me all about what Kumah said. I said, oh, my tech is not Alfred Kumah. He's Kumah in disguise. So now I understand why I'm here, and I thank you all very much. But I know really somebody up there set this up. Okay?
Oh, we want to know what is Dr. Chester. I say na the granddaughter, the grandson. Our free moon na or kind woman be na woman no efa be my own no beside say again na o can very man was it story na for Kofianansi Africa dey need to Kofianansi in some protocol na said ya your papa started the project no with disappointment no on the starting the on the sad note and the grandson no a free and they have a lot in common. The other is on Zufiabuchi, nor the Namwadi Habitate. Once again, let's put our hands together for Dr. Chester. Now, what couple of rules said, I want to ask you as a who's one terrible. What can I really? I'm going to be. Once again, you know what you want. And Papa Mandilia, your father translator was sorry. And I'm going to give you a sorry, I say on translating. When you start here, ladies and gentlemen, I'm happy to be here. You know, I'm not for when you say you are the Wabaha. It's been a tiring journey. Tell your car, Manti. That's obey Kumah Jackie. Also, going on carbon or carbon on the battle. You're tired now. We'll be joined by Mr. Emmanuel Ajiman Frimpong, Prudential Bank Manager. Oh, let's put our hands together for Prudential Bank Manager. Yeah, yes, so I bet you sure say Bank for Nina Sika and Futuro Komuno Yaripe, the Gomba Kumah Medical Center. Regional Chief Nursing Officer, Mrs. Zinabu Ado, is also here. Please, you welcome. Thank you so much for joining us. Regional Administrator, Health Services, Mr. Peter Boateng, has also joined us this afternoon. Ebachomewo Nananum Almufri Asokore New Dropping North. I say, Yadu Muti Etudra Nana Krampa Pipagu Mensa Dabre Hini Ewe Yentem Yemo Yensemano. Oh. One more so more dabre gini. One more so more dabre. Aha. Nana chiamiche ewe yentem nana yadasi. Nana chiamiche untume di efe. I say blaster jesi. Efe papa. Nana jemfua amono benkum hima ewe yentem nana yadasi. Yekuona ba. Yekuona fua abutre eye mo weapon yadasi nana se abekanya ho nana akon bensua eye eduana hima ononso o eduana hima yadasi obonsema ye maame nana siedu e happy nana akwaba yadasi ena togbe Ahakura. I hope I got it correct. Togbe Ahakura Yedase Akwaba. Mr. Owusu Bempa, Administrator, Hope Exchange Medical Center, Ewo Kumasi, Ononso Abeke Yehon, Mwakwaba. Meka Owusu Bempa, Obia Faces of Owusu Bempa, Debi Ondruha, yes, sir. Very massive. Madaruma, Yatuaju Mediano so. Na Ebraso se, Wajia Oho, Nana. Tete pimpon a otoso emienu adweso hene odi na no disem emaye ntimadaro ma mo meji akasem no manana na onfa na no disem emaye mofa esemo ehia na kwan madaro ma
so just batay o ne chere ne be kaso a ho fumbre bong su kere su o pang kero pang su kero pang o pang kero su jo no ma kan 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 kama tu kan ko pa ya me bong o ne chere ne o ja ho kasa
na wose Koforidua pa na wopia wo fatre penyi Koforidua pa na wopia wo enti nana ye penyi Dr. Kumah ne apamfo on Koforidua pa so de be pion we zamampe yo meri fiase na mede shaka sebema etitiru me betra se won abo nyina din Dr. Kumah ne empenyi ne nuanom na ejanom wo fi wa na ne na funu a won na tewo abrofo emu doctors na wo na kwaba eba ajuso ha yefi ha na ansa ne betra ha na yombe ne ha no na efi police commander and the regional police commander yama kwaba ajuso ha if you are titru mate join that the penny bank phone penny phone the home ba e mamu na akwaba e ba ha
okaso asasura kasa
ye chemu e na so e mamu na so akwaba e ba aduso madi eye Kumah medical center ha e mamu na akwaba
okaso
yo medical no ni aya me de wo Jumedi any Kumah medical center on Ankasa Koforidua wosi ajoso
akrakasa
wosi ajoso
okasa
ni enti America sa no
asasura
ni pe bia be ba ajoso ha no na wodi ato Koforidua na e de da papa Dr. Kumah as papa pa say e de wosi una so no akai say corona odi eyilabesis no efi wura ho na ni wura ne ne ajo otu wani hwe menken kan bi mi ntremo Koforidua nursing training school esi ajoso asase eso wadi ayi Koforidua nursing training eye yawo fufi wa no aba stadium so esi Koforidua ajoso
asase wura kasa
asase man kasa man asase wodi ato Koforidua den awon asemen ufi anwa ba kusuapon technical university eno su gogo
asase wura kasa
she hotel sapapa won sawe Koforidua ajoso ni nyina wote won ban Koforidua den asem den kura na ajoso ya mo day na ya mo ya ma bebi atra say na ese ya bio enti papa Kumah medama se papa pa say munya wo friend akuma pa no pepa na modisa oh Israel more kaya tusa mon kai say ajuso no enya drabin yenya santefo kwapefo ma na ye ne ma dwabe fu bebi tran enene akwa ne sa yo efa eno wa o ya fi be kwa ya semo so obia ni say ya akomde den ye nya wasati na sunyina ye ayaresa na eye me de papa pa say enne Dr. Kumah adwene oman no ho adwene adusukuro ho se aye den a ye be yare wonam ye den a wori nyi ni nyina na wa komuden so aye mrewo na wa mama baby bia se obia se bia wawo arikachi ana se wawo mo ye den a wa ye hospital yi amma se ankan Ghana ha ye wo ba ku pe Ghana probita enede abeti ye aboboa no obia eno berima tena na wohwe na awo no eye de ma wo ba ha obroni kokko eye Dr. Caribbean obe frɛ wo berima no afro bia na wa yenche nsenkyerɛni bi na wama mwawo enti momiemfa nsembo kese ema Dr. Kumah say no afi yebewo Mokra titipipo emia manya mate ai wo enidi brofu di na mo mate ase brofu na wo ho mate ase wo kire se wo de ade papa bi aba eha obia no bere matna mfie ebiesa na enkoyi a womra na wo bewo nsenkyerene awo bi na wo ma be fe papa na nyasa so benya akokodu so benya edi Dr. Kumah yemamo mo ediyo nia edi echinso yesre mara ajusukroi yesre mebum se won yire won ho na won ko school na won suade ebi se mu suade no na mu a sese de Dr. Kumah sa aye siboi obefa enyuma ye fokra ebeye ajoso ema obefa enyuma ye fokra kwa ebeye ajoso ma enti mesramo emegum amwo grum ha mon yire mo na mon ko school na school de usuade na usuade ya o kwan aye fo na fi so enyuma ye fo a more Kumah Medical Center ha mesramo ayare fono eya won ho tete wo oyare ni bia na ho tete no o chen jata enti munya abotare kakra ma won mu telephone no mo ma enye mo namfo na mo ma oyare fono enye mo namfo ese mami bia o tena asase so ewiase a wo bonedin wo frɛ no Nightingale na ma Dr. Nightingale yi enejo kron satame na samre no na woni kanea osore enejo kron no wachinchin na yare fo so enti wiase fu nyina tenenka ma wodo ne din a enne obo din Dr. Nightingale na we say eye obia bia obetna asase su kum ne ho ma ayare fo enti me kama mu enware no ye mamu nyina akwa baba ha na meda Dr. Kumah ne nimpenyi ase na busua medical dase na ye dase ye mre ye bedase yo nia edri ye befa meyi ama obia na ya twaso na obia hwene wiase asikna meye especially wosano we didi eni bibia udidi a didi aduane papa di local food fufu wo ampesi wo ayaka agawu no ne ho fro ba yen nana no trans no eno na wo trans a wodi a ene wodi nya 105 eni echi ene tebia mo sore a take away fried rice Indomie Indomie no eno na sisi no nkofo ade ayo won aduan wo fie last me for baby na Indomie na ebusuaku ni nyina woredi na se den na ho kire ene pizza ababa onya kwatna se pepa won to pizza man na wonim ne a ewo pizza mo me sramara mi panyi mobi endidi aduan papa na yemre yewo asase so enware maybe 71 years midi fufu enti mo wa hode Dr. Kumah mesra me ba bewo ababa me odi edime ya be de mewo de ma wo fofo yo everyday say ene ye nyina hia wa ha ene yare bie eya no obia mfa kuma papa na ommoda wuru enchi obia se be bia ni wiase echen Kumah medical center or they to the papa every papa river niema akachi awori na edwuma ya oye enya izo say obenya registration say abanya I register my kwan say ye edwuma yi enya better environmental director be kan no wo je say better na da funti na onya ne better bia na enya better Ghana ha where is car one show madam could be at university or and crying. Well, for say one man lances now on family university based in there 6 years and over is all the bank account. And Miss Ramara Abai in paying for. I am one developers and now say or friend then or mobile. Now eba monya in time na yumamra or mem. Now mo friends in yabi ejumaya na unemployment na doso. I'm a cyber crime. Eba. Onya ya pen wa fani telephone. No, oya ni necessary. Enti Mr. Moshe aban.
Sadia, wa phone ti sem ye you as azeli. Yo ya sema oja wao nana akasa bakasa tepeni o go sema na azazura. Nasema Mose Zunguni Sariki Oma Faruka Pebla Moa Unya Yase Machense Brasso Soko Bompaye and Timadaruma Muswa Pejan Moa na Elidia Kwanswa dia Kwansre na wade atoho Sariki Oma Faruk Yada Sibebre na Mishrao se odi wenunyam abeta tumedie echi alhamdulillah na mi Mishrao bebre Sariki Esre Kwai Obi am misplacing the watch. Am I head ya bedu ha? Okay. Say Wabekina dear. Pachamunsha Nunsu say three Obi Subas and watch Ayra near the corner of Yakoto Tomwale. Papa Sariki Oma Faruk Esra Pai na Yabato Sanfre Hafra Regional Director Mr. John Asumeni Ejapon na onoso na the same Abre. Why am I Semano?
Thank you very much. Good afternoon to everyone. I'd like to ask you to permit me to stand on the existing protocols to make some few submissions here. When the name of Hefra is mentioned, most of the times there are questions on the minds of people because somehow Hefra seems not to be popular. But I think the organizers reserve this moment because of the role Hefra plays in the health sector. Without Hefra's license, you cannot operate any health facility in the country. But it has been mandated by law to regulate all health facilities in the country. And the good thing is that Kumah Medical Center has been licensed by Hefra. I think we can clap for that. It means that they have what it takes in terms of personnel, equipment to render the services they have envisioned to render to the people of this region. And because of that, Hefra, I'm not here alone as the regional head. My CEO is here, and some of our team members are also around. They are in the Hefra staff to support the good work of the Kumah family. And if the CEO is here, and there's anything I'm going to say, he can say it better. If there is anything that I have to do on behalf of HIFRA, I believe the registrar can do it better. So I'd like to use this opportunity that has been given to me to really introduce the registrar to take over, because he is here to give his speech, at the same time to commission this facility. And I think it's the right thing to do, being the main body to oversee health facilities. My registrar's name is Dr. Philip. But before he comes, I would like to say some few things about him. Dr. Philip A. Bambo, Medical Director, was appointed by the President of Ghana as the Registrar of the Health Facilities Regulatory Agency, HEFRA in short, in 2019. Dr. Bambo is an internal medicine specialist. Dr. Bambo has been practicing internal medicine since 2001. He is a graduate of the Medical College of Wisconsin, United States in 1997. He received specialty training in internal medicine at the Medical College of Wisconsin Affiliated Hospitals, Wisconsin. Dr. Bambo became board certified by the American Board of Internal Medicine in 2002. Dr. Bambo has a Master of Science in Renal Medicine from the University of South Wales. I think time will not permit me to say much, but for the sake of time, I would like you to join me to welcome to the podium Dr. Philip Bambo, the Registrar and the CEO of Health Facilities Regulatory Agency. You are welcome, sir.
Mr. Chairman, Nana Ojia Hobo, Obahima, and all the other chiefs here. I think the Zongo chief has just departed. The president of the private health facilities, Dr. Boabeng, the representative of the Eastern Regional Minister, directors, and representatives of the various ministries and agencies of the government, the medical team from the United States, Dr. Swansai of the University of Ghana Law School, distinguished invited guests, esteemed colleagues, ladies and gentlemen, may I have the friends of the media. It is with great pleasure that I stand before you today at the commissioning of this magnificent health complex, the Kumah Medical Center. You can look around. I thought it was just one building, but I just informed that actually these two buildings are part of the same complex. And I'm in awe of the Kumah family for what you have done and all those who supported them. Well done. Let me give them a clap. No doubt this is a significant addition to our nation's healthcare landscape. This hospital represents not only an investment in health and well-being of the people, but also it is a testament to the progress and the transformation we desire in healthcare delivery and regulation in Ghana. As we gather today, it is important to reflect on the history of healthcare delivery in our country, and I'm going to be quite brief. Health regulation in Ghana has come a long way, beginning with the establishment of the Private Hospitals and Maternity Homes Board in 1958. I always stand on this law, and I bully some of my colleagues, especially those in Ghana Health Service. Because whenever they challenge me, I tell them that the law establishing healthcare regulation was before Ghana Health Service. Ours was signed by Osagyefo himself in the second parliament, okay? So you are dealing with an agency that has been here and along the healthcare regulation and healthcare delivery for a very long time. The role of the board was crucial in this time, overseeing the care delivery of private facilities and ensuring that standards were maintained across the sector. For many years, the Private Hospitals and Maternity Homes Board acted as the primary regulatory body for private hospitals and all other entities, setting the foundation for structured healthcare regulation. However, as the healthcare sector grew, so did the need for more comprehensive oversight. The diversity of health facilities and the complexities of modern healthcare delivery, such as the Kumah Medical Center, required a regulatory framework that could respond to these evolving needs. It was with this in mind that the Health Facilities Regulatory Agency, HEFRA, was established in 2011, repealing the previous law. This transition marked a significant step forward, expanding care delivery and regulation to cover both private and public facilities. Thus, HEFRA's mandate became clear. And today, we want the Kumah Medical Center to deliver the care at the highest standards and for the safety and well-being of all those who will need the services from this facility. We have introduced innovative tools such as the Mobile Online Information System, MOIS. With the MOIS, health facilities can now apply for license online. This enhances the inspections and all other regulatory work that we have to do, reducing delays and improving transparency. The digital transformation has not only enhanced our capacity to streamline delivery of care and regulate, but also to challenge the healthcare facilities to become the very best, to deliver their very best. Looking forward, our vision is to uplift the image of healthcare delivery in Ghana to a world-class standard. Health is one of the most critical aspects of our lives, and as such, standards in quality of care framework that supports it must be robust, innovative, and forward-looking. In the coming years, we plan to strengthen partnerships with international organizations such as the Safe Care and JACO, Joint Commission for Accreditation of Health Organizations, and stakeholders to adopt best practices and ensure that health delivery in Ghana aligns with the global standards. We believe that by benchmarking our practices against the world's best, we can guarantee that our health facilities, such as the Kumah Medical Center, are equipped to deliver the quality of care that our citizens deserve. I want to challenge the Kumah Medical Center at this very reception to adhere to the very high standards that the World Health Organization has asked us to do. That the care that we deliver must first be effective, that is, using evidence-based medicine. It must be efficient, that is, in how we utilize resources. It must be timely, because the diagnosis that the patient may receive may require more testing and more care so that they can get to it. In most cancer cases, we wait 6 months. It may be too late for the patient. If that chest pain is not heartburn, heart attack, waiting too long, you are waiting for the patient. It must be patient focused. What does the patient want? What does the family think? What about the caregivers? Those who are actually spending time with the patient have been solicited their inputs. It must be safe for the patient. We should not do surgery at the wrong site. That happens. Patients should never come to our facility to get more sick because infections also occur in the hospital. By what you have done today, you've already fulfilled one of the 6 of my expectations. You've expanded access to those who need it. Not in Koforidua, but Nana, did I get it right? Very good. Very good. We are in the right place. So today, as we move to commission the Kumah Medical Center, we celebrate not only the opening of the facility, but the continuation of our journey towards a healthier and a safer Ghana. It is my fervent hope that this hospital will serve as a pillar in this community, delivering essential services that will improve lives and save countless others. Before I take my seat, I wish to congratulate the management and the staff of Kumah Medical Center, and I know it includes many Kumah families and extended family members, and all countless people who have helped along the way to make today's celebration possible. Your commitment to providing quality health care is evident, and we at HEFRA look forward to your example working with you closely and to maintain the highest standards of healthcare delivery. To our partners, both local and international, I thank you for your support to the Kumah Medical Center in our journey towards building a healthy healthcare delivery system, and that we can become one day a beacon of hope and standard in Africa and beyond. Together, we are ensuring that health regulation in Ghana and healthcare delivery in Ghana remains strong, adaptive, resilient for the benefit of all. Thank you very much, Nanano, and thank you all the invited guests, and thank you everybody who have come to celebrate this special day. Thank you.
Thank you, Dr. Philip Bano, Chief Executive Officer, HEFRA. It is now time to attend to the reason why we gathered here, to do the official commissioning. But I've been informed that because the edifices are two, we'll start from here and then end up in the other building. So shall we be upstanding as Dr. Philip Bano leads us to do the official commissioning of Kumah Medical Center.
We are going, and we know where we are going.
GC 848822. What block you be? Car number GC 848822. And account number GB 189520. Also, what was you looking? What are your memory?
You will explain, but I will support you.
1, 2, 3. 1, 2, 3. Un moment, Samuel. Un moment, Samuel.
Oh, one way, and the entire way.
Mr. Nicholas Kumah. Kumah Medical Center officially.
Yo, NT, the battle speaker, no, Mike. Hello.
Like,
okay.
Yes, the key microphone. The camera microphone is there, so shall I be online with?
Okay. Aha, OPD. doctor ɛwɔ ha nea ɛbɛkyerɛ me so no ɔbɛ explain akyerɛ mo nti aha yɛ OPD nti mo meyɛ nkɔ yɛ anim yɛfi ha aha yɛ pharmacy nti pharmacy no ni pharmacy Bacho ahasa yenti bingo ubeti nyabe ubeti mecha cameraman ngwana allow ahaya la bacho ubeti bingo esramani bingo this special dispensation thank you nana ubeti nyabe ahaya la That's one of them. This is the consulting room. This is the consulting room.
Okay. Congratulations. Okay. Okay, go.
Ubeti miahe. Ubeti miahe kwa mtu ni kwa high fit scan. Ubeti miahe kwa mtu ni kwa high x-ray, high fit scan. There's an extra screen. Because of the nature of the afa ne sei na yɛ pie wɔ ha na afei yɛ kɔ so.
I hire labor ward. Where is Koforidua room? One of the theaters.
We are one of the theaters.
Hey, no. Hey, sorry. Me bacho, you bet me akos ro why?
Me tena se na rest kakra.
Nanga mantere kia. Nanga mantere. Anga ji.
Ya do ko internet. Ya ga do. Excuse me, come. We are touring the facility. At the moment, this is a private ward. Private ward 1.
Staircase for her. Open house and you wake up for once and you have to follow.
This is Kumah Medical Center. And this is the bed. This is the hospital bed. This is the light here. This is the restroom. This is the bathroom. This one of the restrooms here. Charlie, what are the biggest facilities in Koforidua? Just we're female or 2. We are female ward 2. Yes. Unkola, ya unkola, be a deal better. Ya unkola, be a deal more better. These are Ultramodern machines. incubator. Infant incubator here. So incubator, this is baby incubator. This is an ultra body machine.
This is for NICU. No. This is the wall for the
So this is Ultramodern.
We have a ward.
The washrooms are here.
All the washrooms.
We have washrooms here.
We have 5 beds.
And we have 5 bed wards.
We only have 5 beds.
So this for what?
This is for female ward.
Female ward.
This is the female ward.
And we have a washroom.
So this is different from. So that would be the maternity ward.
That's the maternity ward.
And that here is all the.
Exactly, this is
beautiful.
This is a general ward.
What message do you have for? So now we have Mr. Prince, Ogusimensa Clinical. I just want to look at your name.
It's not official yet.
Yeah, so you can see you're still making sure that everything here is perfect, as you can see on your shot. This is another restroom. Doctor's office is there. Yes, there's another one upstairs. So yeah. So this is the last stop. So we have to go and then check the other part of the facility. So guys, this time will permit me to end the live streaming for the official commission of Kumah Medical Center. So, but by the way, short videos and everything will be uploaded on all our digital platforms. So you can see we have NICU, labor ward, private ward, male ward, and female ward. They are all here. Yeah. So, and this is gonna be the nurses station. Nurses station here. So nurses, whenever they are stationed here, and this is the male ward. It's not so. And then there's an elevator. In fact, they make provision for people living with disability. If you know you cannot walk, there's a way out for you. So see that. And this is the mother. The mother. This is the mother. The job of every mother to see your son do something like this to change society. Oh, God bless you. We pray for good health. We pray for good health so that you can see the fruitfulness of your womb. God bless you. God bless you. And that is the mother. I don't go 15 times. Thank you, Omi. So, these are our thermometers. And they are going downstairs. Guys, thanks for watching. Bye bye.